Good afternoon, everyone. Today I want to start by repeating the central message that we have heard, unfortunately, so many times over the last year, that we should never underestimate COVID-19 and the damage that it can do. Today we have recorded an additional 11 COVID-related deaths in Northern Ireland. That's 11 more families who are grieving. My thoughts are very much with the loved ones of those who have died. And can I include the family of Sir Captain Tom Moore, who became the epitome of all that is good and noble about how we have come together in a common cause of defeating COVID and supporting our health service and our health workers. But sadly, this pandemic is far from over. But while we are making important progress, this remains a long-term struggle. There will inevitably be more challenges, more setbacks, and unfortunately more tragedy. But Northern Ireland can and will get through this. We can gain hope and we can gain strength from the progress of our vaccination programme. As of yesterday evening, we have administered 271,826 vaccines. That's an increase of over 13,500 in the last 24 hours. One of our highest numbers of vaccines administered over a single day. And once again, I want to thank our trust staff and our GP teams who are so capably and effectively delivering the programme on the ground. Today I can also confirm that a significant new consignment of AstraZeneca vaccines has arrived in Northern Ireland, and as I stand here this afternoon, those supplies are already out being distributed to GPs across the country and will continue to do so through the rest of this week. And that will allow us to continue the acceleration of our vaccination programme. Our health service has suffered many hammer blows over the past year, but it's still standing, it's still caring, and as well as dealing with the latest COVID surge, it is rolling out an unprecedented vaccination programme. Daily, I am in awe of the commitment and the expertise demonstrated day in and day out by the staff in our health and social care service and the wider health family. They are exhausted and traumatised by what they have been through, but their determination, dedication, professionalism, commitment should be an example to us all. And we owe it to them to do everything that we can to stop COVID-19 spreading. Infection numbers have come down, but they are still too high. We must push them down further and keep them down. We must continue to work so our health service and its staff get the breathing space they need, because they can't continue to go on like this. We know that the virus can and does thrive in enclosed indoor areas, especially where ventilation is limited. That means some workplaces and shops may enable transmission or infection, particularly if all the necessary mitigation measures are not in place and people do not strictly adhere to the public health guidance in these settings. Activities in and around funerals, including wakes and other gatherings, may also increase the risk of spreading infection as people congregate in close proximity. We know what to do. That's follow the rules, keep our distance, stay at home as much as you can, work from home if possible, shop safely, wear a face covering and keep your distance from others. Don't go shopping more than you need to. Wash your hands well and often. Don't take a chance. Thinking it won't really matter, because it might. Even a short visit to a friend or relative's home is a risk, for you and for them. Standing too close to someone in the shops is a risk, for you and for them. Standing too close for a chat is a risk. Every time someone takes a chance with COVID, they potentially add to the pressures on our health service. They potentially make it that bit harder for us all to come through this. Every breach of the rules, no matter how small, can do harm. Every little hurts. So I again urge everyone across Northern Ireland not to slip up now, not to give in now, and not to surrender now. Stay focused and stay safe. We are making progress. Let's keep building on that. There are no shortcuts out of this. Let's keep being inspired by Captain Sir Tom Moore. As we mourn his loss, let us remember that all he achieved, one step at a time. I will now hand over to Sister Liz Moore from Belfast City Hospital, who will give us a first-hand account of the pandemic's ongoing impact and how our valiant health service workers are responding. Liz.
Okay, thank you, Minister. Good afternoon. My name is Liz Moore and I am a ward sister in the post-intensive care COVID step-down ward in the Belfast City Hospital, the Nightingale. We have been caring for COVID patients since last April. The patients coming out of intensive care are very sick and in many cases are unable to do anything for themselves. Simple things like eating, swallowing, drinking, walking, talking. The patients' ages range from 35 onwards up to towards 80. But most of our patients, to be honest, have been in their 40s, 50s and 60s, and some of these patients had no underlying medical conditions. Some of the patients have spent a long time in intensive care, any time from around a week to 66 days, and are so ill and frail when they come to the ward. They are all still require oxygen therapy, various amounts and for a period of weeks or months. Some patients really can become unwell again and have to go back to intensive care. The patient's recovery can take a long time, can take, as I say, weeks to months, and can be very challenging for the patient, but with the help of all of our team, doctors, nurses, physiotherapists, occupational therapists, dietitians, speech and language, domestics, catering, a whole array of our team. We all work together to help the patients recover from COVID and go home to their families. We have a fantastic team and thank them for all their hard work and dedication. We must remember during this time our patients and families haven't seen each other for a long, long time whilst they've been in hospital, and it is such a difficult time for them all. Once they get a bit better, we are able to use FaceTime and they're able to see their families, which is just amazing. The patients during this time only see us, the team, in our PPE with our masks and visors, etc. We give them the encouragement to keep going, that they can do this and recover. Our staff are still facing challenges daily. We've had to have some difficult conversations with families. For example, when a patient takes unwell again, conversations that shouldn't happen over the phone. It has been a tough time for everyone. We are tired, but we are determined to keep going and provide care for all our patients to get through this awful time. This pandemic is ongoing. You may catch this virus, you may feel a bit unwell, you may lose your taste, you may lose your smell, you might have no energy. Or you may be one of those patients who become very unwell and they end up in intensive care and if then come to our ward for recovery. We must all protect ourselves, each other and our amazing health service. So please wear a mask, wash your hands, socially distance, obey the rules and get the vaccine. Thank you very much.
Okay, thanks Liz. Louise Collins, BBC.
Yes, hi, thanks very much. First question just on the virus. Minister, the priority for vaccination for special needs teachers, do you expect that other key workers will now be getting vaccination, or should teachers in all schools get them before schools fully reopen?
Louise, I think the guidance that we have come up to and worked with the Department of Education is that those support staff in special schools actually receive the vaccine, so it may not be the fact that all teachers get it. So it is those support staff who are working in close proximity with children who have special educational needs that need that additional bit of support, close contact support as well. So that's a definition that we have worked through with the Department of Education and is in line with JCVI guidance to keep us within those criteria.
Okay. And if I could just ask something that not directly on the virus, you'll have seen on our website one of the hammer blows that the health service has had to endure is the cancellation of cancer surgeries. More than 4,000 procedures cancelled since March last year. Some are day, some are inpatient surgeries. What reassurance can you offer to people who have had their surgeries cancelled or postponed, who are waiting, and how are you getting this back on track?
Louise, again, apologies, I haven't seen the story on your website, but what I will say, and I think it's something we've said here continually, is in regard to how we are working across the sector to make sure we can carry out as many procedures as we can while still battling COVID. And you'd heard from Liz the lengths that our health service is actually going to. I think maybe to put something into perspective as well, is that our service still continues between the 26th of January and the 1st of February. In total, there was meant to be 4,468 elective procedures across our system in Northern Ireland. 4,054 of those went ahead as scheduled, so our service is still delivering a key part of its core service. In regards to the cancers and red flags, those procedures are confirmed cancer procedures that have been cancelled. You will know that trusts are actively working to offer new dates as soon as possible, and that's been brought forward in the regional model that I announced and our clinicians are working on across all trusts, and again supported by the independent sector. For the use of that independent sector, it is becoming now vital an integral part of our health service, why we work through COVID and why we recovered from COVID as well. In 2019, we used the independent sector, I think, for in the region of 122 cancer operations. Last year alone, in 2020, we actually performed 924 of those operations through the independent sector as well, and we do intend to use more of that to start to combat the waiting lists that we have as well. So while operations are being cancelled, trusts are doing all that they can to actively get those people seen to as quickly as possible, and we are working across all our trusts on utilising the independent sector as well. Deborah McAleese, UTV.
Yes, good evening, Minister. Thanks. We heard some disturbing reports today from the Health and Safety Executive that some people are still going to work despite being positive or having symptoms of COVID. What do you say to those people that are putting others at risk?
I would ask them, our guidance is clear, Deborah, and I think, again, having listened to Liz, someone who works on the front line and supporting people who have come to the worst, the real ravages that COVID actually bring. To those people, you may end up there yourself. You may end up transferring this virus to one of your work colleagues, one of your family members, one of your friends. And I think, as Liz has indicated, this perception that it's only 80 or 90-year-olds that are in ICU, it's not. They're 40, 50, 60-year-olds with no underlying health conditions as well. So this virus is no respecter of age, clinical condition or workplace environment. So if you are getting a positive test or even have had a test and waiting on a result, stay at home, follow the guidance that is clearly there. And look, if you need those financial supports, there are there. The Department for Communities has set up a support grant mechanism that people can apply for. Please ask, because we combat this, we fight this virus by coming together and working together.
And we do hear a lot about the pressure and the strain that frontline workers are under. Are you concerned that post-COVID, quite a few could end up leaving their jobs suffering from PTSD, like we saw many police officers did after the Troubles?
Deborah, the pressures that are on my staff across the health and social care system, I'm always concerned about. I met earlier today and was with the chairs of all the trusts and the arm's length bodies. and it was something that we were talking about. It's something that we were very clear about, that the support mechanisms that are currently there for our staff when they need them, and it is about that reassurance. There are support mechanisms, there are people you can call, people you can talk to when you do feel the pressures of what is a very trying time across our health services. But it's for our staff members, I say to them, be aware that help is there. If you need for it, ask for it, go and seek. And I'm sure, Liz, I don't know if you maybe want to, just from a personal experience.
Yeah, lots of staff are very stressed during this time, and as you say, afterwards it'll manifest itself as well. We do have our occupational health departments, our psychology departments. There is help there that we can access if we need it.
Okay, thanks, Deborah. Rebecca Black, PA.
Good evening, Minister. Wanted to switch over slightly over to Brexit. Cabinet Office Minister Michael Gove is calling for grace periods to be extended for a couple of years. One of those concerns medicines. Can you outline to us any concerns you have in terms of the transport of medicines to Northern Ireland in terms of the new checks, particularly with vaccines, which obviously reared its head last week?
Well, Rebecca, I suppose two points there. Again, was the triggering of Article 16 on Friday evening. I think as I updated the Assembly on Monday of this week, we had a consignment of vaccine already in transit. So our departmental officials worked extensively through Friday evening from the EU triggered Article 16 until we were sure that vaccine was safely in our warehouses on Friday night, to make sure that wasn't going to be a fact. That I met with Matt Hancock then on Saturday morning to ensure that going forward that issue would not be something that reoccurred, because one thing that we actually have in place is that derogation for medicines for 12 months already, and I think if we need to get that extended or put into a firm setting for the next number of years while we work that out. We have had good engagement up until now between my own department officials in Westminster and the EU specifically in regards to medicines, and I would hope that working relationship can continue. But the triggering of Article 16 on Friday evening, specifically in regards to vaccines, I think took everybody by surprise, including many EU commissioners as well.
Thanks, Minister. Well, just to follow up on that, is the department stockpiling any medicines or making any sort of plans for sort of worst case scenario plans? And sorry, if I can just also ask Sister Liz, in terms of the experience working in the Nightingale, can you sort of talk about what this wave is like compared to last year when it started? I mean, can you sort of explain what the pressures are this time compared to last year, just to really sort of help people understand just how much pressure you're under and how things are on the ground?
I think.
No, go on ahead, Les. Go ahead.
I think that this time the patients that we see are a lot sicker. They're in intensive care a lot longer, and they are taking longer to recover. And as I say, the patients, they're not old patients. They're, our youngest patient was discharged last week, was 34, a young gentleman, no previous history, and he was so ill, and it takes weeks for them to recover, weeks and months. So it just seems to affect people. They're a lot iller than we seen last year. That's our experience.
Yeah. And I think maybe one point just to pick up on that, Rebecca, is people shouldn't be under the illusion that once you come out of ICU, that's you going home. There's a long path of support that is done and needed through the recuperation and rehabilitation until people actually get back on their feet and get back with their families again. So when we look at ICU numbers going down, it's not the end of the journey. for many of those people as well, because they still have a long way to go before they get back home to their loved ones. In regards to the medicine stockpiles, it's something we've been working on as a department in regards to contingency planning, and as I said, we had the extension for 12 months on those supplies and derogations. So Article 16 being triggered specifically on vaccines was definitely without our understanding of anything that the EU Commission would consider doing. So I welcomed the fact that they did withdraw that pretty quickly. Tara McLaughlin, Downtown Cool.
Good evening. Yes, first question for both yourself, Minister, and also Liz. I just wanted to ask for an update on military aid to Northern Ireland and whether or not the issue with the Northern Ireland Protocol affected any army medics being deployed, and if Liz, if you could just give us a little bit of an overview as to how helpful army medics have been in alleviating some of the pressures in your wards.
Tara, they didn't have any direct effect because we were only bringing in personnel rather than any specific equipment, which I think was a concern. In the protocol, feedback, and Liz can maybe give more detail, is that they have been widely accepted across our health and social care system because of the skill set that they do bring, because of the fact that they are 110 individuals that are there to supply physical support to people who actually need it to complete the job they're doing. But Liz, do you want to speak?
Yes, we have had the military in the Tower block in the Nightingale just this week, and they are very welcome and they're very helpful. They're glad to be here, and as I say, they're very willing to be part of our team and help us and do whatever needs to be done.
Thank you for that. And I wanted to ask you, Minister, about the vaccine supply in terms of these concerns and issues raised around AstraZeneca and in light of recent events. Are there any plans to have any other vaccine suppliers in terms of Moderna or Novavax in future, or is Northern Ireland going to predominantly focus on Pfizer and AstraZeneca?
Thanks, Tara. I think from the beginning we've been part of the UK forward buying programme. So when all those vaccines come online, come on approval, if the UK, if DHSC has made any forward purchases, we get our Barnett consequential out of that. So just less than 3% of every batch of vaccines that is bought by the UK government, we get our share of those. So while we have the accreditation and the certification for both Oxford, AstraZeneca and Pfizer, and we're using those at the moment, as soon as those come on supply, become certified and become available, we'll fit them into our vaccine programme here in Northern Ireland as well, because every little will help, and every batch will add to our programme, which is already working well.